Good morning. As we transition to leave the year of 2020, I want us to really think about how we can safely have a celebration at home with our family. How can we think about what is going to be the best way for us and our family to create these new traditions? My hope is that you use and be virtual with your friends and family. I also hope that you don't have others that don't live with you in your home. My hope is that you don't have any gatherings in your home. We want you to be safe. The vaccine is here. We are continuing to see individuals to receive the vaccine. We are very excited about that, but we've got to stay the course. We must continue to wash our hands, watch our distance, make sure that if you're not feeling well, to stay home if you're not feeling well. We also need you to wear your mask and continue to do that. Even for those that may have received the vaccine already, we want you to continue to do those things as well. We have to keep Austin safe. It is everyone's responsibility. We've done so well this year, and my hope is that we continue to do well by pulling together. We are stronger together. I'll transition over to Dr. Escott.
Good morning. Unfortunately, the last week has brought us a worsening situation in Travis County and in many parts of Texas. Over the past 3 weeks or so, since the beginning of December, our admissions on average are up 106% since the beginning of the month. Our hospitalizations are currently 365 on average, 404 yesterday, an increase of 67% since the first of this month. And unfortunately, we've seen even more significant impact on our ICUs with a 62% increase in ICU utilization in the past week alone. Our projections forward into the new year continue to look worse and worse day after day. And I think right now it appears that we are going to enter 2021 in a state of emergency. I can't stress enough the importance of us taking note today, us changing our behavior today, choosing to stay home, choosing to decrease gatherings and interactions with individuals without our masks on, continuing to choose to use social distancing and to avoid touching your face, washing your hands often. These simple things, these non-pharmaceutical interventions are the key to managing this disease. Our future right now indicates to us that, in the next several weeks, we may run out of hospital beds. We may run out of ICU beds. And it could happen a lot sooner than that, as early as a week to 2 weeks from now. This is serious. And we've got to realize that we have the opportunity to save lives now. We have a vaccine, and there are thousands and thousands of vaccines being put in the arms of Texans and Central Texans every day. So let's stay the course. Let's tighten the belt a little bit. Let's continue to promote that vigilance from ourselves as well as our family members, and we can get through this together.
Good morning. I'm going to just mainly talk about what we anticipate over the next week. And some of that will be the impact of our holiday gatherings on our case counts and our hospitalization rates. And so we don't know what to expect. This week should be a very telling week for us. And so as we prepare for the New Year's, we are encouraging people to continue to gather within their home and with those people in their household. If for some reason you continue to choose to gather outside of your household, or you participate in non-essential activities such as shopping and being out and about, we ask that you do three things, and one is to cover your face. Make sure your face is covered. Make sure the person who you're with has their face covered as well. You need to avoid confined spaces. So if you're outside, that's better. We've had some beautiful weather here in the Austin area over the last few days, and it's better to be outside where there's plenty of air circulating, and you're less likely to be exposed. And the third thing is to avoid crowds. This is going to be a challenge during the New Year's Eve activities and holiday parties that continue on, but you need to make sure that you're practicing those activities, making sure if you are having any symptomology at all that you stay home because you may be ill with COVID. You just don't want to be spreading this about, and you don't want to get it from somebody else as well. So again, my 3 points: cover your face, avoid confined areas, and avoid crowds if all possible.
Good morning. We are very excited to see our vaccine starting to roll out within our community. Glad to see many new providers coming online as vaccine providers, and that offers us a lot of choice for our varying different population groups that are slated for these first initial phases. We know in the coming weeks, more and more vaccine will become available, and we encourage everyone to take part in that. As they are notified that they are eligible to get vaccine, we hope that folks will take advantage of that opportunity. We're also excited to hear that there is so much interest in vaccine, and so that's very encouraging. In the meantime, vaccine is a tool that we can use as it becomes available. But in the meantime, we've got to continue those preventative measures, because it's going to require that we use all of those things: our hand washing, masking, social distancing, to make sure that we can tamp down the curve and get us to a space that this disease is no longer a threat in our community.
Thank you. At this time, we're going to transition to our pool reporter who will ask questions on behalf of the media. Alicia?
Good morning. First question is from Univision. Question first is, since stage 5 began to take place in our area, how has it been with participation of businesses? Any citations?
The department is working very closely across the city with code compliance, the fire marshal's office, and our environmental health services, as well as Austin Police Department. Those efforts will continue to be in place, typically, throughout the holidays. The thing that is really important is that if you decide to go out with others, and if you see some things that are inappropriate, we would appreciate that you would call 311, and we will definitely have a team that can respond to those 311 complaints.
I'll just add, again, as we've been saying throughout this pandemic, we can't enforce our way out of a surge. It requires each of us, as individuals, as businesses, to understand that the threat is real and that it means hospitalizations and it means the potential loss of life. I don't know something that we could take more seriously than what we're seeing right now. And we certainly encourage folks to follow the regulations, whether they're city, state, or county regulations, because they're meant to protect our health and protect people from hospitalization and death in particular. We're asking our business community, we're asking our restaurants and bars to follow the guidance, to do their part so that we can have a brighter 2021.
Second question from CBS Austin. Governor Abbott has said he expects there to be enough vaccines for the general public by March. Do you agree with this timeline?
I certainly hope that that's an accurate timeline. I think March, April is certainly a very realistic timeline. But remember, when we talk about the general population, we're already seeing the state approving utilization of COVID-19 vaccine for the 1B group, which is part of the general population. That's individuals over the age of 65 or individuals between 16 and 65 that have underlying health conditions. So I think we're going to see a steady increase in those vaccines that are available. I want to applaud Commissioner Hellerstedt for a letter that he sent out last week saying, if you've got vaccine, get it in people's arms. We've been focusing on the 1A group, our healthcare infrastructure and first responders. But in many of those circumstances, we have to stagger the doses, so we're not doing entire sections of the departments or the hospitals. In that circumstance, we need to get that vaccine out to other people if we have to roll that in over time. We're seeing that part of the general population is going to be vaccinated this week. In particular, our nursing home and long-term care facility residents and staff. As we start to increase the percentage of individuals over the age of 65 and those with underlying health conditions, the threat of COVID-19 in the spring starts to diminish very quickly.
And I'd like to add, our goal is to vaccinate folks as quickly as we can, following the phased approach, as Dr. Escott alluded to. Additionally, noting that timeline, we're hopeful if we can get enough vaccine out throughout our community so that there's access by March or April, that's wonderful news. However, I think it's important to note that even as vaccine rolls out, we still have to be vigilant with all of the other prevention measures to protect us from additional disease spread.
Next question from the Austin American-Statesman. Question for Dr. Scott. Hospitalizations in Austin, Travis County are now at an all-time high. So how soon do you expect hospitals to overflow? Do we have spare beds and staffing for when this happens?
So those projections are updated on a regular basis, and I can tell you that every time they're updated, they seem to get a little worse. But it's certainly possible that within a week we can run out of ICU beds. We've seen dramatic increases in the ICU utilization in particular over the past week. And that, of course, is where we have the most limited resources. Once again, we have the hospital spaces, we have the equipment, there are plenty of ventilators. The issue is the staffing. We've got a limited number of critical care staff, a limited number of hospital staff, and that's where we're going to face the challenges, particularly since Dallas and Fort Worth are leading the surge right now in Texas. We've got San Antonio right behind them. We've got Houston behind San Antonio, and we are following Houston right now. So we're talking about the major metropolitan areas in Texas all surging at the same time. That's going to place significant stress on the redundancy of healthcare workers in the state. And we're very concerned that those additional staff may not be there when we need them.
Next question is from patch.com. Did you attribute recent illness spikes to Thanksgiving gatherings, and has this been traced accordingly?
I can start on that, and Janet may want to add in. Again, after Thanksgiving, we saw our case investigation and contact tracing indicating lots of spread associated with Thanksgiving gatherings, where one person in the family was positive and then multiple people. In some circumstances, everybody at the Thanksgiving gathering then developed COVID-19. Then, of course, we see those people who got it from Thanksgiving spreading it to other people. So that cycle is continuing. And that's why we continue to see increases in cases, increases in hospitalizations. And, once again, it's a reminder that we've got to stop the cycle. We've got to break the chain of transmission that's happening. And, we just had Christmas last week. We've got New Year's coming up this week. We've got to decide that now's the time to stop it. Now's the time to protect this community, to protect our families, to protect one another, because we have a vaccine and it is rolling out every day into arms of people in our community. Now's not the time to take chances. Now's the time to protect ourselves, maybe more than we ever have before, and to really make the hard decision to stay home. And if you choose to go out, if you have to go out for essentials, wear a mask, distance, wash your hands, don't touch your face. It's really that simple. Those methods work, and we've got to continue that advocacy for those simple measures in order to break that chain.
And I will just add, and I've said this before in previous media briefings, is that we definitely saw an impact from our case investigation and contact tracing, the result of the Thanksgiving holidays. I have no reason to believe, I imagine we're going to have similar spike in cases probably occurring this week, and then following the New Year's Eve celebration and New Year's Day celebrations as well. So as Dr. Escott said, it is more important than ever now to protect yourselves and your family and your loved ones who may be at risk for developing illness, especially those that are elderly, so that we can have an opportunity to vaccinate them so they don't become ill. But we still need to use those prevention measures that Dr. Escott mentioned, and that is making sure we're covering our face, social distancing, staying home if you're sick. Even if you have sniffles and things like that, you should be even ever more vigilant about washing your hands and avoid touching your face and covering your cough and colds so that you're not impacting anybody else.
Next question is from KOOP Radio. Dr. Christakis, in his recent book, Apollo's Arrow, suggests that an effective NPI is proactive school closures as they reduce social mixing, keep students from acting as vectors, and force parents to stay home. As we enter indoor sports season, would you recommend curriculum of high school sports?
So with the transition to stage 5, we did make the recommendation to our superintendents to cancel or postpone extracurricular activities, because that's where we're seeing transmission associated with schools. In the circumstances where they can't postpone or cancel, that they institute a proactive testing process for those extracurricular activities. But yes, that is the number one place we're seeing transmission of COVID-19 associated with schools. It was football. Now we're seeing that transmission happening in basketball. We're going to see it in other winter and spring sports as well. So that is step 1. The next step is to identify other opportunities to decrease risk. And the discussion that I've had with our superintendents as well as the TEA is that would start with transition of high schools to virtual education, then middle schools, and then elementary schools as a last resort. I think if we continue to see the transmission increases, the hospitalization and ICU increases that we have over the past week, that I will make the recommendation that our schools transition middle and high schools to virtual for the week to 2 weeks following the break.
And I would just like to add that even if these activities are curtailed in the school and because of extracurricular activities are curtailed, it is going to be all the more important that if you have people at home or children at home, that they are limiting their exposures outside of their home. That means not having sleepovers, not having social gatherings in your homes, and not doing those things, avoiding non-essential activities like going out and shopping or eating out, especially during stage 5. Those are the types of activities that are going to continue to help us flatten the curve here in the Austin area.
Next question is from KBUE ABC. Does Austin Public Health know which long-term care facilities will start receiving vaccines today?
That information can be received from the Health and Human Services Commission. And so reaching out to them or looking at their website, you may be able to get that information from there. We will continue our efforts with our long-term care incident management team. That team is working very closely to ensure that all long-term care facilities are connected with a provider, so they will get their vaccine. In the event that one of the providers has not signed up, Austin Public Health will assist them with getting their vaccines.
This question is from Fox 7. Now that we have reached stage 5, what is it going to take to get out of this?
Well, it's going to take us flattening the curve. It's going to take us reversing the trend. Right now, last week, looks like the data's suggesting that our positivity rate went up again from 9.6 to 10.6%, with even higher changes in our surrounding counties, with places like Caldwell County having more than double our positivity rate. This is a statewide issue right now. The state is surging, and we've got to change the trend for not only Austin and Travis County, but everywhere else in Texas. And that's going to mean people understanding the seriousness of this disease, understanding that there are many, many people suffering from COVID-19 right now and dying from COVID-19. They need to understand that while most often it is older people and people with underlying health conditions, that this also does strike younger people, healthier people, and that it's a terrible disease. It is a disease that causes individuals to suffocate progressively over time. And, I think it's going to take all of us to make the decision to stay home, to decrease our risk, so that we can get over this hump, get people vaccinated, and save a lot of lives. I know people are tired, but we've got to push through that. We've got to rally one more time, and really, I think it's really one more rally for a few weeks to get us over this hump, to start the decrease in cases, and to allow folks to get vaccinated and again save many, many lives.
This question is from CBS Austin. Are you in contact with TABC to get them to closely monitor bar on New Year's Eve? How concerned are you about bars being packed for New Year's Eve, since we've been seeing videos and pictures of them being packed on a regular weekend day?
Yeah, so again, I'm a little disappointed that bars have been allowed to reopen despite executive orders to the contrary. And again, there's a loophole that allows them to do that. But that's our number one concern heading into New Year's Eve, is the bars that are operating as restaurants. That they have been packed. People are not masked. And again, this has been the focus of our enforcement efforts over the previous weeks. Those enforcement efforts will continue this week as well. We need them to close. We need them to understand that they are putting public health at risk by being open. And again, we are deeply concerned about people getting together over New Year's Eve. We know that's more likely to be people in their 20s and 30s and maybe 40s. And maybe those people aren't going to have a severe course by and large, but some of them will. Some of them will end up in the hospital. Some will end up in the ICU. Some may die from that, but they will spread it to other people. They'll spread it to people in their 50s and 60s and 70s and 80s who will have a severe course, who do have a much higher chance of needing ICU or dying. And that's not a risk that we can afford. Of course, if we continue to see an upward trend, then we are going to have further discussions about the possibility of a curfew towards the end of this week to try to help mitigate that risk. Again, we don't have much capacity left in our hospitals and our ICUs to take a lot of chances this weekend.
This question is from KXAN. Last week, health officials said there will be stronger enforcement for COVID-19 violations, with more citations being issued. Is this happening? How many bar establishments were cited over the past week?
At this time, we do not have the number of citations that have been issued. However, we do know that our staff across the city of Austin have worked across the city to continue the enforcement efforts, as well as in the county area. Those efforts will continue. But as Dr. Escott stated earlier, we know we cannot enforce our way out of this issue. What is going to be very important is that you can think about doing something today by staying home over the next couple of weeks and not going out to bars to celebrate, whether it's New Year's Eve or New Year's weekend. So our hope is that you will make a better choice and not go out to be in that type of environment. And if you do decide to go out, our hope is give us a call at 311, and we'll do what we can to address the issue.
Thank you. This question is from KUT. There are reports of Chief Brian Malley testing positive for COVID. Do you know how he is doing? And what is the timeline for Austin Public Department and Austin Fire Department to get vaccinated?
Unfortunately, we did hear the news about Chief Manley. Of course, we won't discuss the condition of Chief Manley or any patient due to confidentiality. Regarding the timeline for immunizations, Austin Fire and Austin Travis County EMS began the process of vaccinations already. I understand that the EMS department is about halfway through vaccinating folks who want vaccines. They'll continue that this week. And that's, due in part to our great partners at the University of Texas Dell Medical School, our partners at Ascension Seton, who've had some vaccines to offer our first responders. And that process will continue. We also have our Austin Public Safety Wellness, who has a vaccine allocation, and they will continue to vaccinate Austin Fire Department, EMS, and then some of APD. Again, the focus is on our first responders and those individuals who have a higher risk for severe disease, so those over 65 or those with underlying health conditions. I anticipate that it's going to take another week to 2 weeks to get through all of our public safety folks. But again, we're excited that process has begun and look forward to protecting our first responders who do dedicate themselves to protecting us.
This question is from the Austin American Statesman. Dr. Mark Escott mentioned possibly beginning 2021 in a state of emergency. What would that state of emergency look like? When would it place into effect? What will be required under a state of emergency?
When I say a state of emergency, I mean we may start 2021 with our hospitals full or nearly full. And we're talking about the possibility of within the first 2 weeks of 2020, further exceeding that capacity. We're talking about, the possibility of needing to call in trailers to store additional bodies if if we have an uncontrolled surge like that which happened in El Paso and Lubbock. This is a real crisis, and we are at the beginning of that right now. And whether or not we actually face that, whether or not we exceed our capacity of our healthcare system to care for people, is up to us. And I've said this before, I'm going to say it again. Now is the day to change the risk so that we can avoid that state of emergency. And, it is really up to all of us to make that decision to protect one another for a few more weeks.
Thank you. This question is from patch.com. Will minorities disproportionately impacted by coronavirus be vaccinated first when the vaccine becomes available for the general public?
Austin Public Health is a safety net provider. We know that Hispanics as well as African Americans are disproportionately represented in the data of individuals with COVID-19 and our hospitalization and our death rates. So it is going to be very important for us to ensure that communities of color do receive their vaccine from us as being the safety net provider. So that is our commitment. We're definitely going to work with community-based organizations and advocates to ensure that we set up clinics to ensure that we are providing the vaccine in our community.
This question is from KOOP Radio. Last week, you reported that we know we don't have enough vaccine, particularly to protect the country's 80K healthcare workers. What has changed since then to permit the inclusion of APD officers this week?
So again, we're pleased that vaccine continues to roll out in our community. Part of that allocation has been to our Public Safety Wellness Center. Now, of course, in the 1A group, we have our EMS and our firefighters who are certified medical professionals in providing care to people. We also have Austin Police Department as part of that wellness program. Those police officers are often the first responder. While they may not be medically certified, through as EMTs, for instance, they are providing first aid to people. They are providing help and support to our EMS providers and firefighters. And again, the focus on the APD individuals right now is going to be focused on those who are at higher risk. So those who are in the 1B group who either meet the age criteria or criteria based upon other health factors. Again, it may be some time before all of APD can get vaccinated, but our hope is that our research from the state has been that vaccine will continue to come into our community so that we can vaccinate more and more people every week.
This is the last question from KVU. Last week, Dr. Escott mentioned if things don't get better, morgues will start to overflow. What is the capacity looking like now?
So was the question about morgues?
Yes.
So right now, there's capacity in the morgues, similar to the fact that we have some capacity left in our ICUs and in the hospitals. The concern is that we may accelerate that growth in terms of hospitalizations, ICU admissions, and deaths. As we saw in El Paso, that acceleration can happen very quickly, and we can go from being okay in terms of capacity in the hospitals and morgues to being grossly overrun. And that's why we have to prepare for that. We have a team which is dedicated to mortuary services that are continually assessing that capacity. And if there are projections that we will exceed capacity locally, then they will make the request for additional resources, including refrigerated trailers.
Okay, thank you to our pool reporter. At this time, we will take closing comments, starting with Stephanie.
Thank you. As we turn to close this year of 2020, my hope is that you are thinking about, how can I have a new tradition? Maybe it was something that you did for the Christmas holidays, or maybe it was the way you celebrated for Thanksgiving that was safe, that was with the people that you live with, that you used technology, that you picked up the telephone and called folks and checked on them. Whatever you decide, my hope is that you take the lowest risk possible, that you think about, how can I do this in my home with the people I live with? That is going to be the safest thing. As we think about, most of us, including myself, we establish New Year's resolutions. What is going to be your New Year's resolution? Are you going to be safe? Are you going to make good decisions? Those are things that we can easily check off by saying, I'm going to stay at home and I'm going to be safe and I'm going to think about others as well, so I don't bring COVID-19 into my home. And so my child will not take COVID to their school. Those are things that I really want you to do as you are reflecting over 2020. My hope is that you continue to wear your mask, wash your face, watch your distance, designate an individual to go to the grocery store. My hope is that you continue to support businesses by ordering curbside and pick that food up or have it delivered and have it at home. But please be safe for the New Year holiday, but also continue to be safe as we transition into 2021. Thank you.
Once again, our cases are on the rise, our hospitalizations and ICUs are on the rise. We are beginning to run out of capacity. Today, the Department of State Health Services reported there are 41 ICU beds available in the 11 counties surrounding Austin. It is not an unlimited resource, and that resource is growing smaller and smaller every day. So please take action today to stay home, to decrease risk, decrease social gatherings. Don't interact with people without your mask on. It's those simple things that will help us through this next couple of weeks, get us past the hump, start the decline of cases so that we can have a better outlook for 2021. But it takes all of us doing our own part to stop the spread and flatten the curve again. With that, I'll pass it over to Janet Pichot.
Yeah, as we ring in the new year, I just, all these things that both Dr. Escott and Stephanie has said are just vitally important so that we have a healthy and safe 2021. Again, wearing a mask, social distancing, washing your face and your hands, and avoid touching your face, washing your hands, and making sure that you stay home when you're sick. These are the things. My hope for 2021 is that you don't have to hear me say those 4 things ever again, that it is just inherent in what we do every day. I mean, it's prevention that works, and I'm hoping that everybody takes that to heart. They're probably tired of hearing us say it, but we know these things work. And so again, if you do happen to go out and are involved in any kind of non-essential activities, you need to make sure that you follow the 3 C's too. Cover your face, avoid confined spaces, indoor activities, get outdoors if you can, and avoid crowds if all possible. And I hope everybody has a very happy New Year.
And finally, just to reiterate, as we look ahead to 2021, we all have a part in thinking about how we can make 2021 a healthier and safer year for all of us. This is a time that many of us set New Year's resolutions to make healthier choices, whether it's to stop smoking, get more exercise, eat healthier. Preventing COVID can be a part of those healthier choices. And so thinking about in your New Year's resolutions and those plans, are you going to get the vaccine when it becomes available? Are you going to continue to practice those protective measures in your home, in your workplaces, and out in the community? I hope that we can all look ahead to 2021 and see that we will conquer this disease and we will have a healthier and safer new year and other years to come.
Thank you. That concludes our media availability for today. Thanks to APH Director Stephanie Hayden, Dr. Mark Escott, Chief Epidemiologist Janet Pichette, Cassandra DeLeon, Interim APH Assistant Director of Disease Prevention Health Promotion Division, and to our pool reporter, Alicia Ramos from Univision. Thanks for joining us and have a safe day.